Well, Ontario is putting more regions of the province into the red zone of pandemic measures. The latest modeling showed yesterday there could be 6,500 new COVID-19 cases per day by mid-December. Earlier, Premier Doug Ford announced Ontario is adjusting the framework it uses to determine the level of restrictions in each region.
If we don't take action, if we don't change course in a big way, Ontario is on track for 6,500 new cases per day. That's 6,500 more people who will catch this awful virus each and every day. And based on current projections, intensive care units could be overwhelmed in 6 weeks. The impact on our hospitals would be absolutely devastating. As Premier, I can't accept that, and I won't accept that. My friends, we can't let that happen. We must do whatever it takes to slow the spread of this virus. We must do whatever it takes to stop our hospitals from being overrun. So we're here today to take action.
CBC's Megan Fitzpatrick is at the Ontario Legislature, Queen's Park in Toronto, and she has more on today's announcement.
Right, so what they announced today was a change in this framework that they just recently announced, John, this color-coded system. They have lowered the thresholds that dictate what zone or region is in. So, for example, under the previous framework, the weekly incident rate of case rate had to be more than 100 cases per 100,000 people in order for a region to be in the red zone, and the positivity rate had to be above 10%. Today they've announced they've reduced that significantly, so the incidence would just have to be 40 cases per 100,000 and a test positivity rate of 2.5% or higher, John. What this means is more regions in Ontario are being moved into the red zone as of Monday. Those include Hamilton, Halton, and York region. Peel region is already in the red zone. Toronto is due to be in the red zone starting this weekend. But Peel and Toronto have both imposed their own restrictions on top of the provincial ones, what they allow. So, for example, in Toronto, indoor dining is still going to be shut down for another month or so. So they've changed the rules, essentially, or the criteria for each of those color-coded zones. Why they did that is because of the modeling that came out yesterday from the province, which showed Ontario on a very bad track, essentially projecting about 6,500 cases per day by mid-December if things don't change. And so Doug Ford calling that data and those projections alarming, John, and saying that's why they made these decisions today. And the advice for people who live in those red zones: don't leave home. Essentially, they're saying only leave home if you have to for essential things like work, school, medical appointments, grocery shopping. Otherwise, stop socializing and stay at home as much as possible. Doug Ford said we are staring down the barrel of a lockdown. And then the question, John, was, what will it take to trigger that lockdown? And Dr. David Williams said he is seeking that advice from the public health measures table. What would it take and what would it look like? And he said those answers should be coming next week, and then they will make recommendations to the Premier. And then the Premier said he will lock down quicker than you can blink if that is the advice that he gets, and that he won't hesitate to do that. As you mentioned, he was quite defensive at times today. Sounded a little frustrated too, John, about the direction that the numbers in Ontario are going. 1,396 new cases today, and he urged people in this province to not be complacent, follow the public health protocols in order to bring these numbers down.